Have you ever wondered whether Xelstrym, the ADHD patch, might be helpful to treat the symptoms of your ADHD? Hi guys, I'm Dr. Kid and I've spent thousands of hours working with patients with ADHD, and in this video I'm going to give you a concise review about all you need to know before starting Xelstrym as a medication. In this video, what I'm going to cover is what it actually is and how it works, how to use it for the best results, why would you use this patch medication as compared to other stimulant medications for ADHD, who are the patients who should not use this medication, and what are the key side effects to look out for if you do decide to go ahead with the medication. So what is Xelstrym? Well, Xelstrym is a patch that contains the stimulant medication dextroamphetamine. Dextroamphetamine is actually the active ingredient of another well-known stimulant medication known as Vyvanse or lisdexamfetamine. It works in the same way as other stimulant medication by increasing two chemicals, dopamine and noradrenaline, in an area of the brain known as the prefrontal cortex, which is an area at the front of the brain. And this area of the brain is responsible for executive functioning. The patches come in four strengths: 4.5 milligram, 9 milligram, 13.5 milligram, and 18 milligram, and they're all delivered over 9 hours. The starting dose for patients aged 6 to 17 is the 4.5 milligram patch, and the starting dose for adults is the 9 milligram patch. So how do you use it for the best results? Well, it's best to use it in one of the 10 recommended sites, as shown in the diagram here. This diagram shows 5 sites, but this is only one side of the body, so if you include the other side of the body, that's a total of 10 sites. Ensure the area of skin that the patch is applied to is dry, so no lotions or creams, and also clean, so no cuts or rashes. Pick an area that is hairless or virtually hairless, and try to apply the patch to a different area of skin each time. While the patch is on, try to avoid heat sources to the patch, as this may alter the rate of absorption. So when would you use Xelstrym as compared to other stimulant medications for ADHD? There are two main reasons, the first of which is if you have a patient that cannot take oral tablets. An example of this would be a patient that has a medical condition that causes swallowing difficulties. The second reason is that the patch can be removed at any time, giving more control over onset and offset time compared to tablets. Typically with oral medication, if you take a short acting, you're usually committed to 3 to 5 hours of on time for the medication and up to 12 hours for a long-acting stimulant. Therefore, for ADHD patients who want very fine control of their on and off time of medication, Xelstrym may be the best option for them. By the way, if this information is helping, don't forget to like and subscribe to the channel. So who should avoid using Xelstrym? If you have any of the following conditions or use any of these medications, the use of Xelstrym should be avoided or used with extreme caution. Severe cardiovascular disease or severe hypertension or high blood pressure, as Xelstrym can increase blood pressure. Psychosis or bipolar disorder, as Xelstrym can precipitate psychosis or mania. Raynaud's phenomenon, which is a condition that affects the hands and feet and leads to poor circulation and often discoloration of the hands and feet. Xelstrym can exacerbate this condition. Patients with severe skin reactions to patches. Patients concurrently taking a medication class known as the monoamine oxidase inhibitors. This taken together with Xelstrym can precipitate a hypertension crisis. This is a very old medication that used to be used for depression and is not commonly used anymore. Other serotonin increasing medications. This can increase the risk of a condition known as serotonin syndrome, where there's significant lability in temperature and increased muscle rigidity. It can be dangerous and may lead to hospitalization. This condition is rare, and this contraindication is not an absolute, as there are many patients with mental health that will be taking concurrent medications that increase serotonin, but it's important to be aware of this risk when taking Xelstrym and those medications. So what are the key side effects to look out for when you're taking Xelstrym? Well, the most common side effects are headache, nausea and vomiting, reduced appetite, and difficulty sleeping or insomnia. The last thing to mention is that it's really important to do regular monitoring when taking stimulant medications such as Xelstrym. Most guidelines would recommend monitoring blood pressure, heart rate, weight, basic blood tests, and an ECG. So that's my concise review of Xelstrym. If you're interested in taking an oral equivalent as you don't want to use a patch, check out my video here on Vyvanse, which actually, when it's broken down in the body, has the same active ingredient as Xelstrym. You can check out this video here, and I'll see you in that next video.